Today's chief complaint is a 39-year-old man that comes in with severe headache. What catches my attention when he describes this headache is that he says that it gets better when he lies down and gets worse when he sits up or stands up. Usually if I hear anything about positionality, I get concerned. And I've mentioned this before, but if it gets worse when you lie down, I am worried that there is blood in the brain. But if it gets better when you lie down, I'm worried that there could be the opposite thing happening. Instead of there being too much of something like blood, there could be too little of something, like the fluid surrounding the brain. And if we keep losing that fluid surrounding the brain could actually sag out, which could lead to death. So I really need to figure out what's going on with him so that we can stop it before it gets worse. He says that early in the day, he was fine. He was at the playground, he was playing with his daughter who's 6 years old. They were going up the jungle gym, and as he was coming back down, he fell backwards. He fell on his back about 4 or 5 feet. But he was able to stand up. He played with his kid a little bit longer, drove home, made lunch. But then 2 to 3 hours later, he started having a really bad throbbing headache. He describes the headache as both sides of the front area of the brain, and he says it feels like something's pulling in his brain. He says that the headache gets a lot worse when he stands up, and it gets better when he lies down. And he lies down within 10 to 15 minutes, the headache is almost gone. He rates it as about a 2 out of 10 on the scale of severity when he's lying down, but when he is standing up, it is unbearable. It is excruciating. So he presented to the ED. So he says that the headache is unbearable when he stands up. Not only does he have a really severe headache, he also has sensitivity to light and sound. He has some neck stiffness as well. So with everything that he's telling me, I'm really worried that the fluid surrounding the brain or the cerebral spinal fluid is leaking. I think he has a traumatic CSF or cerebral spinal fluid leak. And with that, things I'm worried about is that could actually lead to an infection. He could start having meningitis with that leak happening. Another thing that I'm really worried about is that when you have a leak, the brain starts sagging. It brings the vessels with it, and he can actually start to develop blood in the brain. All of this could lead to death. So I really need to figure out what's going on with him. On my exam, it's actually pretty normal. His vital signs are all intact. His mental status is intact. His cranial nerves are normal. His motor exam is normal. His sensation exam is normal. His coordination is intact as well. The only thing I did not test was his gait. Every time he would sit up or stand, he started having an excruciating headache. So I deferred the gait exam or his walking exam. When I looked at his back, I actually didn't see any obvious lesion. I didn't see any scarring or markup. There was no bruise. It was just a little bit tender when I started touching the bottom part of the back, suggesting that he did indeed fall back on his back. So overall, based on what he's telling me, that his headache gets worse when he is sitting or standing and gets better when he's lying down, I'm truly, truly concerned that he has a CSF leak. The other things I'm considering is that this could be vascular. He could have had some type of tear from the fall that led to the pain in his head and his neck. It could be infection. He does say that he has neck pain, he has sensitivity to light. All of those could be in the setting of meningitis. He doesn't have a fever, but we could still consider meningitis. The other things we're thinking about is trauma. He did fall on his back, so that could be what's leading to the CSF leak as well. So what we need to do next is imaging. Even though I'm worried that this is a CSF leak, I still need to rule out a bleed. Bleeds in the brain can present in a lot of odd ways. And so the first thing I'm going to do is a CAT scan. I want to look to see if there's any acute blood in the brain. When I do the CAT scan, I don't see any acute or new blood in the brain. So next what we do is an MRI. An MRI is more sensitive than a CAT scan. And now what I'm looking for with an MRI is there any sagging that's going on? Is there any evidence that part of the brain is kind of sagging out of the skull that could suggest that there is indeed leakage of the fluid surrounding the brain? So when we do the MRI, we do see that. We see that there's a little bit of sagging going on with the bottom part of the brain. This part right here, we see it kind of like sagging out of the base of the skull. And what we call that is intracranial, or within the cranium, hypotension or low pressure. And that is a true suggestion that the fluid surrounding the brain is leaking out. A CSF leak is what we call that. So I'm really glad he came in when he did. The symptoms weren't too severe yet, and all we had to do were some supportive measures to help him feel better. When he told us that his headache got worse when he was sitting or standing, what that is telling us is that gravity is working to pull that fluid out of the surrounding area of the brain, and that's what's causing his headache. So as he's lying flat and gravity can no longer work to bring that fluid out, he is creating new fluid. And so what we did was also help him. We had him lie flat, we gave him some intravenous fluids as well, and some caffeine to help with the headache. And within days, he started feeling better. Sometimes if people aren't so lucky, we might have to do a procedure called an epidural patch, where we actually essentially just patch up the area that's torn, and that can also help prevent more leakage from happening. But for him, he was able to just get those fluids, lie flat, and within a few days, he was actually back outside playing with his daughter again.